This video is to assist you as you collect your samples for our dried urine test for comprehensive hormones if you're taking oral hydrocortisone. So when we say hydrocortisone, that is exactly the same thing as cortisol, which is a hormone your adrenal glands make that we're testing extensively in our test. So it's challenging to take it orally and do the test, but it can work effectively. You just need to make sure it's done correctly. So what is the solution for this scenario? So again, we're talking about oral capsules, those sorts of things with Cortef, hydrocortisone, cortisol, those are all the same thing. So you have two options. You can test while you're, quote, on therapy. In that case, you want to take the AM dose right after sample number 3, which is the waking sample. The directions will tell you specifically not to do this, to not take any hormones in that time period, but this is an exception. Wake up, collect your waking sample, take your hormone right away, and then you'll end up collecting 2 hours later. So if you have an afternoon dose, usually this would be a smaller dose, you can just take that 2 to 4 hours before those samples, which usually would be sample number 1, which is around dinner time. Now there is another option here, and we need to be careful with this one. If you want to know not what your body looks like while on the hormone, but what your body is actually making, you need to skip the dose the day of the test. Now, you do not want to do this if you're taking a full replacement dose. In this case, it's probably not a safe option to get off of your hydrocortisone. So with the larger doses where it's a full hormone replacement, that also suppresses your body's ability to make the hormone. So A, it's not safe, and B, it doesn't actually produce useful information about what your body is making if you're taking so much that you're suppressing it, unless your doctor's trying to figure out if the dose is so much that you're suppressing it. But you've got to be really careful with that. Please speak with your healthcare provider if that's the option you're taking. Usually that would be with the lower doses of 5 milligrams, maybe 10 milligrams. So in that case, you can see what your body looks like on the therapy, follow number 1, or you can skip it the day of the test, and then you can see what your body is making. So you'd wake up, you'd take sample number 3, you would not take the hormone, and then collect 2 hours later to catch that morning surge of cortisol that's coming from your actual production of the hormone. So ask your provider if you're not sure, and it's very important to make sure you let your provider know which of these options you're taking, as well as make notes on the requisition form so we know what you've done. One more note on that is if you are taking a smaller dose, not a replacement dose, and your doctor gives you the go-ahead, you may want to skip it for 2 days if you can. 1 day is enough to get an accurate assessment of free cortisol, which you can see some example results here. But we also are including the cortisol metabolites, and you probably need to skip it for 2 days in order to flush that out enough to get an accurate representation of what's going on in those particular cases. So if we show actual results here, this can be helpful to see what kind of thing we're looking at. So the first case is without oral hydrocortisone. This is a patient who wakes up and we get this value of 4.2 for the overnight period. And then there's a surge of morning cortisol over those first 2 hours without taking any additional of 28. Now you can see that puts her in the bottom of the reference range, and then she's got a sample around dinner time, which is below the reference range, and then a sample around bedtime. Now when she is taking oral hydrocortisone, in this case, this particular patient took a very large dose, so she gets a very big number in the early morning. And then this dinner time sample is also following a smaller dose, which gets her up into the reference range. So this is just an example of a patient who did this both without and with a dose, and albeit a fairly high one. And then you can see the reference or the results here for the cortisol metabolites get quite large when you're taking oral hydrocortisone. And important for the provider to know that the free cortisol results are thought to be a good representation of circulating free cortisol, whereas these metabolites are going to be slightly artificially increased because of first pass metabolism, which is a little bit of a confusing concept, but the providers can understand what's going on there. So here's another example of a patient who took 25 milligrams in the morning, which is a relatively large dose, got the results up quite a bit in the early morning, and then the results come back down within the afternoon. When you look at the metabolites of cortisol, you can see they're out of range. Some approach to this would be to look at the free hormones and consider those, as we said, accurate. But then for the metabolites, to try to keep those below about 1.5 times the reference range there, because there is somewhat of a bloating of those metabolites from the hormones that go into the gut and get processed rather rapidly and end up in the urine. So again, your options: test on therapy, take your dose right after sample 3, or skip the dose the day of the test. And again, do not do this if you're on a full replacement dose unless you've cleared this with your provider. So work with your healthcare provider and figure out which of these you want to do. Ask your provider if you're not sure, and then make sure you note what specifically you've done. And that should be the best way for you to get meaningful results on the test while on oral hydrocortisone therapy.